Welcome to this episode of Let's Talk, where we zoom in on the practical implications and the next steps around the big sessions here at the Milan Congress. And in this one, we're talking about the Plenary 2, which was all about borderline cases regarding failing implants. And you have three choices. Are you going to keep, are you going to treat, or are you going to remove? My name is Gerrit Heijkoop, and I'm very proud and happy to be joined by the chairs of both the Congress, co-chairs, and the chairs of this Plenary 2 session. Isabella Rocchietta. Isabella, welcome.
Hello, thank you very much.
And also with us, Francesco Cairo. Francesco, welcome back.
Hello, thank you.
Now, before we dive into the learnings and the implications of this session, let's start at the basics.
Yes.
Isabella, why did we have to talk about this threefold choice and failing implants in general?
Well, I think that this is a very relevant topic. We have been seeing an increased number of dental implants positioned by perhaps general practitioners all around the world, and this is good news. But on the other hand, we have also noticed a rise in implants that are not particularly placed with a correct diagnosis at the very beginning, leading then to misplacement or to somehow problems. And we're seeing unhappy patients. And we wanted to, and I share this with Francesco very much, we wanted to bring it to the plenary because it is a very clinically relevant, everyday topic.
When we talk about failing implants, do we know anything percentage-wise, roughly? What is the incidence? Where are we in piece of the pie?
Well, it's quite difficult to have the final numbers, I would say, but basically if you're going to talk about perimplantitis, meaning
for example, one of the causes,
infection, we have studies suggesting that the prevalence of perimplantitis is around 20-25%, so a huge number, I would say.
Exactly.
If you think about worldwide, the number of global implants positioned, that's a huge number.
Exactly. And you say both things we see. We see the rise of implantology, so we see more implants being placed. Obviously, implants stay for life, so we see a growing potential population of failing implants, and we see quite a high incidence. Now, once we have a failing implant in the chair, three options, I understand.
Yes, indeed. Well, the implants are not for life. This was something that we have learned throughout the years. They were given us as an information for life, but we have to be honest with our patients. And again, I think we touched this today very, very well. The three options is very simple. In reality, it's two options. Either you keep and you treat because the patient is asking for something, for treatment, because the patient is unhappy. And when I'm talking about unhappy patients, I'm talking about people who are socially challenged by their situation. We've focused on the aesthetic region. And we have patients who come to us and they may not have a boyfriend or a girlfriend, or they may postpone a marriage for this, or they simply do not smile. And this is heartbreaking. Perhaps if this has been done by because of a mistake, then it makes us feel a little bit even more anxious to deliver a good result afterwards.
Exactly. And then so you narrowed it down. So we keep and treat, or we remove. Do we have any clear indications or contraindications to go one way or the other?
Well, I think that our session was definitely really interesting. I think it would be really interesting for people who watch that, because I mean, we had three beautiful, incredible speakers that very thoroughly discuss the limits and the real indication for trying to do the best. And they put on table their own experience, and they very honestly admit what they can do and what we can do or can suggest. So I think that it's not easy to create the perfect borderline in between to extract and to keep, but basically it's very important to do diagnosis and to try to, distillate the elements that can suggest how predictable is to keep or predictable is to extract.
Yes, and he's very right, because it depends, to answer your question, we cannot answer it because it's very now custom-based in terms of every patient is different and every case, and we've seen three completely different cases treated in different ways. However, the bottom line is always the same. We have to avoid this happening, meaning at the very beginning. And how do we do this? By carefully diagnosing. It's always the same story.
Exactly. And I thought you were going to say, how do we do this? By proper planning and but of course, once we are dealing with a failing implant, that is too late now. So I see that in the session you had three very distinctive perspectives. You had a perio perspective, a surgery perspective, and a prosthodontic perspective. Were there any surprises in the differences between these three perspectives for the both of you?
We didn't have any surprises. Actually, we saw that they had different approaches, and I think that we're all biased, to be very honest, with what we know. We tend to look at our patients according to what we trained, and that's why we picked on, for example, the prosthodontist asking, but would you have used the connective tissue graft? Clearly, it's not his scope of interest, right? And so he found an excellent solution, which means that we, periodontists, for example, have learned even more that sometimes we have to refrain from being in our comfort zone and looking at all the different perspectives. And that's the key to the interdisciplinary approach, I guess. What do you think?
Yeah, I think you're totally right. I think that there are some very provocative elements in this session that may be to try to go outside your comfort zone as a clinician, and to try to explore, the reality, and to try to put the light under a different position. And I think that in this very complex and multifaceted scenario, these elements are really important. There are probably different solutions for the same clinical case.
Yeah, exactly. And you mentioned the word provocative. Now you make me curious. Can you give us one tip of something that you found rather provocative that you heard on stage?
Well, I think that the most provocative one is to suggest to clinicians to keep the time, irrespective to the type of procedure, to keep the time. I mean, it's not an Instagram message, but it's very important from a clinical standpoint. Every solution is surrounded by the right time. You need the right time to do the temporary prosthesis, you need the right time to do the surgery, to wait. I mean, unfortunately...
Wait a second, what dimension of time are you talking about? Are you talking about time in the protocol, saying weeks, months, or even longer? Or are you talking about time, taking the time to place these things? What element of time are we talking about?
I believe both.
Both, I was going to say both.
Absolutely, because, I mean, we need time in a longitudinal sense in order to have enough time for the healing phase that are different and sometimes very sophisticated and complicated. But we need a lot of time in order, for example, to obtain a satisfactory learning curve and to develop scalability to treat this very advanced case.
Yes.
But I think if you go to the patients, the modern patients in the late 20s in this stage, they say, wait a minute, time? Isn't it implant or a new tooth in a day nowadays?
But that's exactly what we as professionals have to fight against. And he mentioned the Instagram cases. We need to fight as a group of professionals against this, because this is destroying, in a way, the perception from a patient perspective. I have not found, and unfortunately I have many years of work behind my back, I've not found one patient who complained about the timing, waiting timing, when you explain why. It's as simple as it is, because you don't go to the cardiologist saying, well, if you need to put a valve replacement, I need to go up on the Kilimanjaro tomorrow morning, okay? So it's extremely important to respect the biology and the timing of healings in all perspectives. And we are seeing too much marketing, too many messages that are surreal. And I think our session, what was perceived as really important was that the speakers accepted reality of things, and sometimes you need to accept a compromise.
Exactly. So these are strong words.
Yeah.
Destroying the patient perspective of timing, and actually a call to action to all colleagues.
Yeah.
To do what? What is the next step to actually bring that perception a little bit back in reality?
Yeah, firstly, I believe to think that sometimes something can be wrong. And we have to accept that we are not superhero, but although we are really experienced sometimes, error can appear, but basically it's very important to identify errors and to try to correct them. I think this is
as a professional yourself.
Yeah.
Yes.
And also be open about that, not only to yourself but also to your patient.
Yeah.
You see, Gerrit, this session was all based on cases where they come to you and they had multiple. If they're lucky, they had one failure.
Mm-hmm.
If not, they have multiple failures. We saw one of the cases, the last case was a 24-year-old who had multiple surgeries, orthodontic treatment at the age of 24, because she started with a missing one tooth.
Mm-hmm.
Think about it. Put this into perspective into the patient's mind. Patients are fed up. Patients have lost trust. Patients have spent financial money on their cases. So we suddenly are in the position where they really rely on us. And here comes the message that we came across today. It was, let's be realistic and let's not over push our possibilities to do something. Let's do something that we know will succeed, or at least has a high percentage of success.
Exactly, and that's where we come to congresses like these to know where we stand in terms of evidence-based dentistry and what we can and cannot promise. Anything else that you hope this session will evoke in the practice of the attendance next week?
My suggestion is for young students.
Yes,
we
indeed.
put on table these elements, and as educators, as teachers, as a professor, I think that it's very important for young students to think in a very critical way, keeping under control the enthusiasm in treating very difficult case and accepting to do a very nice learning curve. So it's very important, the surgical education in order to develop scalability. I think at the end of the story, education, study is very, very important.
And this is, again, time. They have to be humble and learn from people who have a lot of years of experience, and humbly, slowly learn. This is the only way to achieve really, really good results, because ultimately the patient deserves good treatment.
Yeah, I hear you. But at the same time, I'm also thinking, but wait a second, are they not humble? Are they not expecting a learning curve? Do they come out of dental school expecting they can do a full arch restoration?
The truth, Gerrit, is that today we're living in a world that is very different from quite a few years ago. And of course, there are loads of extremely talented younger colleagues who know the road.
Exactly. But you feel the need to put this message out.
We feel the need because we are observing that the internet world, so in the not the reality, but the virtual world out there, is giving not wrong messages, but fast messages, pre and post, and
not only to the patients that we mentioned, but you see also to the professionals and the colleagues as well.
The
apparently,
wow effect.
Yeah.
And I think that reality is not the wow effect. So you can get to the wow effect, but it takes time.
Exactly. So it's time to put some realism on both sides of the chair, so to say. Wonderful. Thank you so much for sharing the key learnings and insights of this session, Isabella Rocchietta and Francesco Cairo. And I expect that you are now just as curious to watch the full recording of this session as I am. So make sure you dive deeper into this Milan online library and go educate yourself based on science.